Okay, welcome back. Before we start math, a good question that was asked of me during break. And so this goes for all the freshmen, pharmacological class and therapeutic class. The freshmen, everyone is going to do their drug words presentation on Tuesday, right? But this is something new to the freshmen. And I'll tell you the difference. So the question was, Ms. How is therapeutic class different from pharmacological class and drug class? Okay. First thing, on the PTCE or the board exam or anywhere you're asked of, they're not specific. They just ask you what the drug class is. That's a terminology, okay? What's the drug class, okay? But if we want to be specific, it can be a therapeutic class or a pharmacological class. And I'll tell you exactly how I remember and differentiate the two, okay? But before I tell you, please remember, PTCE tip, that if you're asked of the class, it's either a therapeutic class or a pharmacological class. So the next question is, which one's more important, Ms. L? They're both important. Why? Because usually the question is, what's the drug class? Okay. To be more technical and specific, I'm going to tell you the difference. Does somebody remember? I think Michelle remembers and Brian remembers. Okay. Okay. Brian, tell me what's the difference between therapeutic class and pharmacological class?
Therapeutic can be like what it does.
What it does. Let me put that on the side. What it does. Okay.
And then pharmacologic is kind of like the textbook answer. So
textbook answer.
Yeah. So this is the actual class of the drug. So it could be a beta blocker or benzodiazepine, like that.
Mm-hmm. Okay. Michelle, what do you remember? How did I describe or differentiate the two?
Therapeutic class is easy to visualize.
Therapeutic class is easy to visualize. Okay. Easy to picture or visualize. Okay. What about pharmacological class?
That's usually based more on chemistry.
Based more on chemistry or chemical configuration of the drug. Example. Okay. This one's easy to picture because if I say analgesic therapeutic class for a narcotic, okay, what does it do? For pain, right? But if it's the chemical configuration or the chemical formula, pharmacological class, it's hard to picture. Okay. Michelle started off with beta blocker, is what you were saying. Okay. Beta blocker. Okay. If you're not in pharmacy, you hear beta blocker. Can you picture beta blocker? Nuh-uh. Okay. But what does a beta blocker do? Continue, Brian.
For hypertension.
So it is an anti-hypertensive therapeutic class. Anti against hyper increase, tensive blood pressure. Can you follow? So the therapeutic class is the medical terminology for the use of drugs. Okay. Beta blocker is hard to picture. It's based on the chemical configuration of the drug. Follow? But on the PTCE, the question will only be, what's the drug class? So they can give it as antihypertensive or they can give it as beta blocker. Can you follow? Another one. I'll put here, let's add to that, ARBs. Angiotensin receptor blocker. Can you picture that? Pharmacological class. Can you picture antihypertensive as well? Yes, therapeutic class. Let's add to that. ACE inhibitors. Angiotensin converting enzyme inhibitors. What's that? Pharmacological class. Because it's based off the chemical configuration of the drug. Antihypertensive therapeutic class. Know that therapeutic means therapy, treatment. Prophylactic means preventive. Okay, those two terminologies will always show up too in pharmacology. Any questions? Yes, Daya.
Is it the same example when you did it? I don't know if it was for one of those basically like therapeutic classes, like when you're explaining it to your mom in pharmacology class and explaining it to someone that's in the medical field.
Correct. That's a good one. That's why I say, and Michelle repeated, easy to picture, because it's more like a medical term and you're explaining the use to your parents or somebody not in the medical field. But when it's pharmacological, it's space of chemical configuration, because so not a layman, no layman can understand it, or somebody not in the medical field can understand it. That clear? Okay. You understood, freshman? Clarification? Okay. In the PTCE though, they'll just ask, what's the class? So it can either be therapeutic or pharmacological. Good job.